dystocia in sheep and goats and their management under field conditions. I am working as a field veterinarian since last 10 years. I am just sharing the learnings which I learned in the last 10 years here. So coming to the dystocia in sheep and goats and their management. As we all know, the normal gestation period in sheep and goats is 144 to around 157 days. On an average, we can take it as 150 days. Majority of the time, these animals will be presented with the dystocia before the onset of parturition. So many times we will see the abortions under the field conditions. And during abortions also, there will be many times there will be dystocia. And dystocia in sheep and goats is comparatively challenging when compared to other species means due to in majority of the time, the sheep and goat will be brought to us very late, since they will be there in the flocks and usually they may be gone missed. Sometimes the onset of parturition starts, but the owner will identify it after some time. So majority of the cases will be presented to us very late, and they will be handled by owners. Usually 99% of the cases will be handled by the shepherds only. So they will handle some majority of the time. What happens if the both forelegs are coming out, they will just pull it. So it will lead to lateral deviation of head. And because of this, they will try, all the shepherds will try one by other, and the animal will go to shock, and the animal will be with huge pain. After that, whenever it is not at all possible for them to remove the kid or lamb, they will bring the animal to us. So majority of the time, we will get cases very late, and they will be very mishandled. And there are so many economic constraints too. When we are treating, economical constraint is the very, very important thing, since the majority of the owners will not be ready for the surgeries, and they will just sell the animal, and they will not allow their animals to get operated. So many economical constraints are also there. So because of all these, the dystocia in case of sheep and goats is challenging. But the sheep and goats are the wonderful animals. They are most easy animals to handle. So we can handle it with minimum assistance. In my experience, sheep and goat survivability is more when compared to other animals. And steps to be followed when sheep or goat is presented with the dystocia. First step, whenever an animal is presented to us, we should first examine the animal. Sometimes what happens, there will be straining due to some other reasons also. The animal owner will bring the animal telling that there is a dystocia. First, we should decide that whether the animal is presented with dystocia or not. We should confirm about the dystocia by examining the animal, examining the vaginal cavity. Whenever an animal is presented, we should take it on the table. We should first examine the animal for the cervix is dilated or not. We should examine the animal whether the cervix is dilated or not. This is the first step whenever a case is presented to us. If there is incomplete dilatation of cervix, then we should assess that whether we should wait further, or the animal needs surgery, or we can remove it manually. These things will come to our mind. Whenever they are presented to us, the animal will be under severe shock and severe pain, since it will be handled by many to us. So first, whenever animal is presented to us, like this, many cases will be presented, whole that area, perineal region is swollen because of the mishandling of the animal. This is another case with very huge swollen vulval region. So animal will be with a lot of stress. So whenever an animal will be presented to us, before examining the animal, we should check the animal from the distance. If there is swollen vulva and animal is under distress, first administer the analgesics. I always use dexamethasone for this purpose whenever a case is presented with the dystocia, since it will act fastly, and it is a wonderful analgesic, and it will act also to overcome the shock. So first we should administer the analgesic. Second step is, before attempting to relieve the dystocia, we should first do lumbosacral epidural anesthesia. In case of cattle, we prefer caudal epidural anesthesia. That is, at first intercoccygeal space, we will give around 4-5 ml of anesthetic, 2% lignocaine, in case of attending dystocias. But in case of sheep and goat, the space is wider and it is easily approachable at lumbosacral epidural region. Since the cauda equinae distribution in case of sheep and goat is minimal when compared to cattle and buffaloes, Here, whenever sheep and goats are presented, we should give lumbosacral epidural anesthesia. So this will reduce the pain which is already there in the animal, and also this will be helpful whenever we are attempting to remove the lamb or kid. So it will be painless, and already with the animal is already under the pain. First, we are reducing the pain with this, and second thing, it will be helpful to attend the animal further. So lignocaine 2% is available. The lignocaine dosage is 2 milligram per kg body weight. This is most important thing. That is, whenever we are doing practice, we will be usually using lignocaine 2% as the local anesthetic. But in case of sheep and goat, the toxicity is more. Since the maximum dose which we can use is 5 milligram per kg body weight, maximum. In cattle, we can use up to 10 mg per kg body weight. But in sheep and goat, the maximum we can use is 5 milligram per kg body weight. Usually what we get the lignocaine is 2%. That is around 20 milligram per ml. 20 milligram per ml is the available lignocaine. So here, whenever a case is presented to us, we should just calculate it. If the animal is around weighing around 20 kg, the dose rate is 2 mg per kg body weight. That is 40 mg. That means the dose we should use to that animal is maximum is around 2 ml. 2 ml is enough for this particular case. So whenever we are doing this, first we are going for the epidural anesthesia. And if the animal is as the surgery has to be done on the animal, we should not cross the limit of 5 mg per kg body weight. So we need more volume when we are doing infiltration for the surgery. We need more volume for the distribution of the lignocaine. So we can make it 1% by adding the NS. So if the total dose we can use is 2 ml, we can add further 2 ml normal saline or distilled water. So it will become 1%. So we can use it. This is the most important thing, since the toxicity by lignocaine in sheep and goats is more. If there is further toxicity, if we see, and then you should use intralipid solution. So that is the thing that is not easily available also. First of all, we should always use the correct dosage. Maximum, we should go up to 2 mg per kg body weight. If needed, we can dilute it and use it. That is the take-home message from this. So site for lumbosacral nerve block, that is epidural anesthesia. Here, this is the point of doing lumbosacral anesthesia. So here, we will get a depression. Here, there are the two bones of os coxae exactly at the center. I will just show this through the video. Exactly at the center, we will see these are the two bones of the os coxae, and exactly at the center, there is a huge space. First, we should remove all the hairs presenting at that region. So here is the animal presented with the dystocia. So I am doing lumbosacral epidural anesthesia. So I shaved it and antiseptic is applied. And after that, I am using in 20 gauge needle for this purpose. So I am just inserting the needle at 90-degree angle. So we are here to know that we are there in the epidural space. 1 drop of anesthetic can be given. Here we can see I am just putting 1 drop into the needle. So this is called as dewdrop technique. 1 drop anesthetic on the needle, it is just sucking in. So this indicates that the needle is correctly in the epidural space. So coming to epidural anesthesia, 1 ml per 100 kg body weight is the recommended dose for the epidural anesthesia. So the sheep and goat will be on an average, they will be weighing around 20 kg. So the actual dose needed is just 0.2 ml. So we can add further 0.2 ml or 0.5 ml NS to this, and we can give it epidurally. And in some cases, I used even 0.5 ml also. Just we can insert it, we can check it and give it. Sometimes what happens is we will be there in the subarachnoid space. Whenever we are there in the subarachnoid space, we will get cerebrospinal fluid. So actually, that is not the exact site to give the epidural anesthesia. Whenever we are getting cerebrospinal fluid, we will be actually there in subarachnoid space. If we give anesthetic to that space also, nothing will happen. It will act suddenly. That means it will be fast action. That is called as spinal anesthesia. That is when we are giving anesthetic to subarachnoid space by removing some part of cerebrospinal fluid. That is spinal anesthesia. That also can be given if we just withdraw the needle for a few millimeters. we just withdraw it. Whenever you are getting cerebrospinal fluid, just withdraw the needle for few millimeters. Then you will be exactly in the epidural space. So there we can give the anesthesia. That is the lumbosacral epidural anesthesia. Main point, my point here is we can go for spinal anesthesia or epidural anesthesia. Both can be given. So very less work is happened when about spinal anesthesia. Majority of the vets we are practicing the lumbosacral epidural anesthesia. This is the must thing. So after giving the anesthesia, immediately within 5 minutes, the animal will go to recumbency. The animal will feel both the hind limbs will free drowsy, and the animal will start sitting down. After that, take the animal to the table. Then just pass the fingers. So we can assess the relaxation of the cervix. And decision should be taken based on the condition of the animal. Whenever a case is presented very late, the animal is already under stress, the animal is already under recumbency. So when we are manipulating for manual removal, it will take much time and it will give more pain to the animal. Whenever it is the condition is very, very grave, vulvas are very swollen, we can decide it to just go for the cesarean. So other thing is assessing. That is, whenever a case is presented, we should first assess it that whether it can be removed manually or this needs surgery. So that assessing is very important. How to assess it means just examine the animal for opening of the cervix. If the cervix is completely relaxed, so we can palpate, we can just pass 2 fingers and just check it. We can palpate all the parts of the lamb. So that means the cervix is completely widely open. So we can insert our hand slowly with the application of it along with the lubricants. So we can pass our fist and we can hold the lamb or kid and we can pull it out. So whenever the relaxation is complete, we can go for this. Whenever the relaxation is not there, so only 1 finger is we are passing. So then we should decide that whether we should wait or not. So we can give fluid therapy. The animal will be under stress. We can give normal saline or RL along with the painkiller dexamethasone and an antibiotic. And we can tell the owner that wait for some time. The cervix will wide open. So some veterinarians uses velathamide bromide. So there are controversies that the velathamide bromide will work, it will not work. There are controversies but in my experience, I never used velathamide bromide in sheep and goats and even in large animals too. So I will wait for if the animal condition is good, we can give fluid therapy and we can give antibiotic and tell them to wait. So we can wait for if the animal is presented today, we can wait up to tomorrow if the animal condition is good, and then we can decide. And otherwise, if the cost of the animal or the lamb is very much important, we can directly go for cesarean too. So that is assessing the relaxation of the cervix. If the cervix is completely dilated, we can go with the manual removal of the lamb or kid. So first we should decide about this. So the arrangement for handling a dystocia, every way we should go with this. First thing is we should search for a flat surface. When we are working under the field condition, when we are treating the animal at the doorstep of the farmers, we should make available that any flat surface with a height of minimum 3 feet. So this will be comfortable to the vet who is attending. If we are attending in the dispensary, we can take the animal onto the table. Otherwise, we can take the animal onto any surface. This is the ramp in my veterinary hospital to get down the animals which are brought from the distant areas. So this is the good place for attending the dystocia. We can give a soft bedding here, take the animal here, and we can attend the dystocia. So otherwise, at the village doorstep, we can take any height, minimum of 3 feet height, we should be taken, and the animal should be taken on that. So the main thing is the protective things, that is the full length glove. So Brucella melitensis abortion is very high in case of sheep and goat. Majority of the time in the last trimester in the last month, they will be presented. The lamb or kid will be dead already. There will be foul smelling and the placenta will be hanging out of the body. If you pull it, it will be leathery appearance. It will be hard to touch. So it will be all the cartilagens are already separated from the lamb. So all this indicates that there is a high chance of brucellosis in that animal. Brucella melitensis is a very pathogenic organism to the human beings. So we should always take care that we should always wear full length gloves. If possible, we can wear goggles too. Actually, as I am using my goggle, I am not adding further goggles, but they are important. Covering the complete eye is very important since brucella can be transmitted through eye also. So another organism which is causing the abortion is leptospirosis. Both are very pathogenic and they zoonotically very important. So always while attending the dystocia in sheep and goats, we should wear full length gloves. So lubricants, liquid paraffin or carboxymethyl cellulose can be used as the liquid lubricants. Even the commonly available vegetable oils too can be used. So I am using liquid paraffin regularly for the as a lubricant. Coming to the step 3. So when first the animal is when the animal was presented, I gave analgesics. The first step. Second thing, before giving the analgesic, I just checked for that animal is whether affected with the dystocia or not. After confirming, I gave analgesics, and after that I gave lumbosacral epidural anesthesia. So after that, apply the lubricants. The third step is apply the lubricants. I'm here pouring the liquid paraffin here. So we can see that part of some part of the fetus is visible outside. So with the help of 20 ml syringe, I am pouring the liquid paraffin into the birth canal. So this will make our work easy. So already some fetal contents will be drained out. So placental contents will be drained out when presented. So we are creating the fluidity there. So I have just passed the some quantity around 20 ml of liquid paraffin is poured into the birth canal. After pouring, we can pass our fist into the birth canal. So like this, we should use, even we can use carboxymethyl cellulose and also other vegetable oils. So then assess the cause for dystocia. We should take few minutes to assess it. So there are variety of conditions, as we all know in case of sheep or in cattle and buffaloes. Similarly, there are variety of conditions, maternal causes, fetal causes will be there. And we should assess why the dystocia has happened by examining in the vaginal cavity. So there are so many causes will be there. Coming to the signs, so the animals will be presented like this. The animal will be dull and depressed. It will be abduction of the both hind limbs, and crouching of the back will be visible, and some discharge will also be noticed from the vulval region majority of the time. If it is a very much handled case, vulval swelling will also be seen. So I am just going through different presentations, just explaining the basic things from case to case here. So this is a one condition, that is the only head is visible outside the body. So no limbs are visible, only head is visible. So the owner tried for it, and he was unable to pull the lamb, the kid. So he brought the animal to our dispensary. What to do? Whenever a case is presented like this with only head out of the body, then we should decide that we can take out the fetus by two methods. One is we can push the head inside the birth canal. We should push it. If there is space, there is lubrication, then we can pull it inside the birth canal. So after complete pulling, and we can take out the forelimbs first. Along with the head, we can pull it out. This is the one procedure can be followed. Another thing is decapitate the head. That is decapitation. That is removal of the head of the fetus. So after removing, we will get, whenever there is no space at all to handle, we should go for decapitation. So if there is lubrication, if the head can be put inside the birth canal, then we can pull it into the into the uterus, and we can take out the forelimbs and we can pull it. Whenever there is space and whenever the cervix is completely dilated, we can go for the first one. Otherwise, we should decapitate it. We will get some space, and after that, we can remove the fetus. So here it was a case presented with the only head. So I am just applying the liquid paraffin with the gloved hand. I took the animal on the table. So I am just, this is a fast forward video. Just because of the time, I am just fast forwarding it. So I with the gloved hand, I am just applied the liquid paraffin and I am pushing the head. I also didn't know whether it will go in or not, just trying it. So I succeeded in pushing the head into the birth canal. So after that, I am once again applying the liquid paraffin around the space. After that, I am just slowly I am passing my fist. So if the cervix is completely dilated, we can pass completely. I just entered into the field. I thought that in sheep and goats, we cannot pass complete fist. But after lubrication and after giving anesthesia, if the cervix is completely dilated, we can pass complete hand into the vaginal cavity. So I have just passed it with whenever this can be done only when the cervix is completely dilated. And here I after that I am pulling the head and I made it corrected and I took both the forelimbs and I removed it. So this is the fetus which was dead and presented. This is another case. It was a very delayed case. So the whole head, at the neck region, it was strangulated. The animal died and whole face was swollen. This and animal was in recumbency. So here there was no space for handling. So I just did decapitation. As I already explained, I took the animal to sternal recumbency. I gave epidural anesthesia. After that, I did decapitation. That is the removal of the head from the fetus. After that, I got space. I just pulled the calf in the lamb inside, kid inside, and I just took the forelimbs and pulled it out. The complete fetus came out. So this is another animal. So another presentation. That is, sometimes the goat or sheep will be presented with only one leg outside the vulval region. So here one limb is outside the vulva. So here there will be usually some deformities with the fetus will be there, or sometimes twins will be there. And whenever unilateral carpal flexion may be there. So first we should give epidural anesthesia, and after that pull the one limb which is outside the body to the inside. We should take out another limb which is flexed, and along with the head only we should take it out. And if the cervix is very much dilated, so we can hold both the eyes of the animal orbit. We can hold it through the one hand. We can pull it out easily. So here the fetal anasarca was there. Both the fetus were swollen and fluid filled. So because of this, there was dystocia, and I attended it. So this is the floor which I used to do the dystocia. So sometimes both the limbs will be outside the body. So whenever an animal is presented like this, how to go? So that is, first we should ascertain that whether these are the forelimbs or hind limbs. How to determine it? Whether it is forelimb or hind limb. So after lubrication, if we insert our hand, we should just check for the carpal joint. In case of forelimb, usually the carpal joint will be whenever there is carpal joint, it will be straight. If it is hind limb, then there will be tibiotarsus. So there will be, we can easily identify it as a hind limb at the hock region. So carpal region and hock region are very much important to identify whether it is a forelimb or hind limbs. Whenever the two limbs are presented like this, first we should go, I assess that whether these both are forelimb or hind limbs. So we should examine both the limbs. Sometimes what will be one forelimb and another hind limb. The animal owner will be pulling it continuously. Then the fetus will not come out. That will give more stress and that will tear the uterus or the cervical region. So first we should do whether we should identify that both the limbs are either forelimbs or hind limbs. If they are both are the forelimbs, definitely inside there will be a lateral deviation or ventral deviation of the head. So first, after lubrication, after giving anesthesia, this has to be placed back into the uterus, and we should correct the position of the fetus, and with simultaneously all the things should be taken out. This can be done only when the cervix is completely dilated and we are getting the space. Otherwise, the cesarean will be the only option if it is not possible to take out the head of the fetus. So we should decide based on the examination findings. If both are hind limbs, it will be very easy. Then since there is nothing to disturb, so we can just pull it. So it will come out. Only should be done after the sufficient lubrication. Sometimes there will be only tail only visible outside the vulva. So that clearly indicates that there is hip lock. So hip region is there and tail is outside the body. So first we should lubricate and we should just push it inside the uterus. After pushing, if it is possible, we can take out the both the tip of the hind limbs. After that, we can remove it. So if it is not possible to push it inside, if there is no space at all, and if it is completely dry, we can pass a small pipe into the uterus and we can lubricate it. After that, we can try it once. If it is not possible, then we can go for the cesarean. I will just explain the cesarean in the next future slides. So sometimes there will be no fetal parts will be visible. So animal will be presented to us. Same thing, we should go for the anesthesia and painkillers. After that, examine with the lubricants. we just assess what is the condition and take it out. So this was a case presented with the lateral deviation of head. So sometimes more than 2 limbs will be palpable. This was a case which was with deformity. So many deformity, it was very tough to identify whether these are the 4 limbs or 9 limbs. All are looking similar and disoriented. 3 legs were outside the body when presented, and there was even spinal inversion, just like in case of cystosoma reflexus. It was a very deformed animal. So we removed it manually with the proper protocol. So another thing is, very important thing is, whenever a case is presented, first we should give painkillers, then anesthesia, then manual removal. After that, we should give the fluid therapy. The animal will be under lot of stress and lot of shock. Immediately after handling the dystocia, the intravenous fluid should be given to overcome the shock, and the toxins will be there. So usually the animals will be presented after 24 hours after the onset of dystocia. So during this time, we should give the fluids. Minimum around 500 ml of NS or RL should be given just to remove the toxins which are already there in the circulation. So this will definitely lead to good success rate. I followed this procedure in almost all the cases which I treated in last 10 years. So success rate is very good. So handling the animal after the dystocia is very important. So many animals will die due to pain, and so many animals will die due to toxemia. So in order to overcome it, we should give fluid therapy, and the antibiotics should be given in every case for minimum 3 to 5 days after handling the dystocia. So this will minimize the incidence of tetanus and many infectious diseases, and also this will be helpful to tackle the metritis. So this is the thing, we should give anesthetic, the analgesics for 3 days, antibiotic for minimum 3 days, even though it is a simple dystocia. After that, attending the dystocia, we should give antibiotics and fluid therapy on the day 0. So this was a case presented to me after 48 hours after the onset. So it was easy. After lubrication, I removed it and I am giving the fluid therapy. The animal recovered very well. So this is another animal showing straining, and this is the presented. So when the animal was presented, first I examined that this is presented with the dystocia or not. So just passing the finger, I am just checking that whether the cervix is completely dilated or not. So if the cervix was dilated completely, I will go give anesthesia and I will further do manual removal. So if the cervix is not dilated, then I will give fluid therapy and I will ask the owner to wait. If the fetus is already dead and the animal is presented very late, I will just decide to go for the cesarean. I will have the words with the farmer if he is ready, and I will just go with the cesarean. So this is the case presented. After giving the epidural anesthesia, the animal, both hind legs are drowsy. Animal went to recumbency. So after that, I handled it. So here I am taking the animal to. I took the animal onto the table. So with the gloved hand, I am using liquid paraffin for this particular case. And after applying the liquid paraffin, I am just entering the vulval cavity, vulval canal, birth canal. So after first I am passing just one finger. This is how we should approach. First, slowly we should pass one finger. After that, we should pass second one. So if there is sufficient space only, then only we can insert our whole hand. Without knowing the status, just if you are trying to pass complete feast, definitely that will lead to stress and the animal will go to coma because of the excess handling. So after making the position correct, I took one limb first. So after that, I took another limb along with the head. So after sufficient lubrication, the whole dead fetus was taken out. Majority of the cases presenting to us will be very late. The fetus will be dead by the time when we attend the dystocia. Though the main primary basic thing is to make the survival of the both fetus and also mother. Majority of the time they will be presented with the dead condition. The fetus will be dead already. So I am just showing how we should remove the fetus. So with the proper anesthesia, and I just remove the dead fetus. This was the dead fetus. After that, we should give the fluid therapy. and animal will recover nicely after the treatment. This is after the procedure, the animal will be under recumbency for few time, and it cannot be since there will be the animal will be under caudal epidural anesthesia or lumbosacral anesthesia. So we should give some time. After that, it recovers, it can be left for the grazing. So this was a case. This animal was giving 4 kids per time, and this was attended around 2 years ago. There was dystocia after delivering 2 kids. This got struck. So I did attended the dystocia. After 2 years, the same animal presented to me. I transferred to a new place, but the owner, because of the faith, he bought the animal to me once again. So with the dystocia, the animal gave birth to three kids. The fourth one struck. So he bought the animal to me to my new veterinary hospital. So I am giving lumbosacral epidural anesthesia. Some placenta hanging out is also can be seen. So after that, I examined. It was completely widely open. Since the animal already gave birth to 3 kids, it was widely open. So I attended the dystocia. Since it was very much dilated, the fetus was removed with the lubrication, and after giving the analgesic, the animal is doing good now. So this was a beautiful animal giving 4 kids per time. Fourth one was struck. So another 3 are very healthy. This animal is living happy life now also. So I just corrected the position and removing, since there was complete relaxation of the cervix. So this is another case which was presented to me with a very badly handled. So complete intestine of the that mother is coming out. It came out through the vulval region. If any case is presented like this is better to sell the animal to slaughter. So in my experience, the survivability of this dam is this Eve is very nil. So we should just explain the prognosis to the owner, and before attempting for anything, we just give the analgesics and we can tell the prognosis to the owner. This is the very badly presented case. So we should take the decision as it comes to us. So this is a case with the excess handling. It presented to me. There was severe swollen vulva. So the fetus was taken out. The main thing, what I want to tell here is, so this is a uterine torsion case. So animal was presented with the torsion. So similar to the large animals, the sheep and goat will also be presented with the torsion. So this was a case of uterine torsion, and this case was presented with severe straining, and there was severe straining, and when we passed the hand, we can easily identify that there is uterine torsion. This was an animal presented with the uterine torsion. First, I took the animal onto the sand pit. So this is very important, taking the animal to the sand pit. So then, after confirming the torsion, similar to the large animals, I just placed one wooden plank here. So I am explaining the owner to just push the wooden plank onto the animal. So similar to the large animals, we should pass our one fish here. We can just examine it. So after that, one person should put the pressure from here. So after that, another person should pull it to the other side of the body. So after this procedure, we can check that the torsion is cleared or not. So usually after this procedure, if we pass our hand, we can easily identify that whether torsion is corrected or not. The same animal, the animal one, I did corrected the torsion, but cervix was not dilated completely. I explained that to the owner, and I just sent him to the home. By evening, he sent this photo. It gave birth to a normal lamb. So if after removing the torsion, if the cervix is not dilated, we can just wait for few hours. So if it is a very delayed case, if the cervix is not dilated after removing the torsion, so if cervix is not dilated, if the animal condition is very bad, we should go for a cesarean. If the cervix is completely dilated, if the fetus can be taken out, it should be took out immediately. But in this particular case, cervix was not dilated, but there was torsion. So I just removed the torsion and sent him home. It gave birth to a healthy lamb. So this is about uterine torsion. The main thing which I want to stress here is in my presentation is, whenever many patients are presented, we will be having very less time in our dispensaries with the regular cases. Usually this type of animals will be bought without notice to the dispensaries. These are very time consuming. So majority of the time, we will try to attend it manually. And we always try for the manual removal, but we should keep it in mind. Whenever we are trying for manual, the time duration and the effort which we take for the cesarean when compared to manual attempt is very less. And coming to cesarean, in case of sheep and goat, the surgery cesarean is the one of the most simplest surgery in among all the surgeries of the animals, since there are very less complications and which can be done by everyone. So whichever the time taken is around 30 minutes. 30 minutes will be the maximum time duration which we can take for doing a cesarean. The animal will be under severe stress. So when we are attending to remove the fetus manually, we will take more time than the cesarean. We are trying more methods. We are just inserting our hand and we are manipulating. If we do that more than 10 minutes, definitely the animal will collapse due to pain and because of the handling, excess handling. We should keep it in mind that we should just assess it. We should just attend for removal manually. If it is going more than 10 minutes, then we should decide for going for the cesarean. In our hospital, whenever a farmer calls me that he is bringing a sheep or goat with the dystocia, I will just tell my assistant to prepare one surgical set. Since majority of the time, we should be prepared to do the surgeries. It will not take more than 30 minutes also if we are having sufficient all the instruments with us. So this is more simplest thing. So then we can reduce the pain to the animal, we can reduce the loss to the farmer, and the surgery will be economical also. This doesn't need any costly materials. This just needs one catgut number 1 and any non-absorbable sutures. So this is not a costly surgery at all. We can do it with the very economically. We can do it at the farmer doorstep itself or with the at the in the our dispensaries too. And I'm just explaining these things to the youngsters who are all just entered the field. So one should not attend manual removal more than 10 minutes. So this is the main thing. Otherwise, the animal will collapse even after attending. Even though we remove the lamb or kid, the mother will die after some time because of the excess handling. So we should always keep this in mind and we should act accordingly. So this is the case which was presented to me. I just attended this case. We can see some bleeding on the table. So I attended this animal for 10 minutes. So I thought that we can remove the fetus manually. We can remove it. I tried it since I was able. I thought it will be. I can remove it. Unfortunately, this animal died. So this is the only case where I seen failure among sheep and goat dystocias. So I removed the fetus, but the animal died. So that maybe the animal was presented to me very late, and I insisted the manual removal. Instead of that, when the animal was presented to me, the vulva was severely edematous and swollen. I would have gone for cesarean in that animal. I failed to decide about whether to go for manual removal or for the surgery. The animal was already in the guarded condition. I went for manual removal. I succeeded. That means there was success in the process, but the patient died. So that is the one thing we should keep in our mind. Coming to different approaches for cesarean. Sheep and goats, in sheep and goats, everything is easy. When coming to cesarean, every approaches are easy. So in large animals, we will face so many difficulties whenever we approach for a cesarean. Sometimes we are unable to take the uterus out. Externalization of the uterus is the main important step during the surgery after for the cesarean. But sometimes when the cases are presented very late, we will be failing the externalizing. But this problem will not arise in case of sheep and goats. Whatever may be the approach, the uterus will be easily externalized and it can be operated. So some of the approaches we can go for this approach, that is just below the flank fold. Here we can just above the udder, we can go for this. In humans, it is called as modified Young's approach. So in large animals also, we always practice. This can be the one side. Another side is just giving straight incision just at the caudal flank region. This also can be done, or oblique incision can be done. Cesarean can be done by any approach. Even we can go for midventral approach too in case of sheep and goats. These are the different cases presented. Here I gave one straight incision. In this, I gave one oblique incision just below the flank fold and above the udder. And in this particular case, I gave oblique incision just above the flank fold. We can go for any approaches which is comfortable to us. But Whenever a case is presented, before doing the surgery, as I already explained, we should first give fluid therapy, anti-inflammatory, and after that, we should prepare the site thoroughly. We should not fail to do any important basic steps. So first, we should do the site preparation by thorough scrubbing, and after that, give the infiltration anesthesia. So we can calculate the lignocaine required, and we can make it 1% by adding the normal saline. We can give infiltration anesthesia at the surgical site. So hereby I am doing the externalization of uterus. So I just gave incision onto the skin, then to the subcutaneous tissue, then muscles, then peritoneum. I just removed. After that, I am extending the incision with the scissors. This is the uterus. So immediately after entering the abdomen, this uterus will be visible. It should be taken out. That is the important procedure. So all the contents of the uterus should come out. No content of the uterus should enter the abdomen. So usually these are the attended cases with others. There will be definitely inflammatory fluid and foul smelling contents in the uterus. So any content of the uterus should not enter the abdomen. That will give to success of the surgery, even in case of large animals too. So externalization of the uterus, this is the most important step. So first we should take out any part of the uterus outside the body. We should drape it. So after giving the incision here, all the content should come out. No content should enter the abdomen. So then incision should be always given from the ovarian end to the cervical end. And we should avoid cartilagens coming on the way. We should just palpate it and we should decide why to go for the incision from the ovarian end to the cervical end. So this will lead to this will prevent the accidental damage to the ovary. So further conception will not be hampered. So we should palpate it, we should avoid the cartilagens and just give the incision. After that, take out the calf outside and just pull the uterus outside. So all the parts of the contents of the uterus should come out. So 1%, the assistant should be already instructed that he should just pull the uterus outside along with the calf, so that the content of the uterus will come out during the cesarean section. The same procedure, same principle should be followed in case of large animals too during the surgeries. But in case of sheep and goat, while doing the cesarean, we will get very minimum difficulties. So this was a case attended in the midnight. So here we can see the cartilagens and all the contents of the uterus which are coming out after the procedure. So this is the incision from ovarian end to the cervical end. So all the content should come out. Then coming to the suture, always start the suturing from cervical end. That is here we are not observing this is the head. This is the head side of the animal. I took the animal to the right lateral recumbency. This is the tail side. So this is the tail side, means this is cervical end. This is the end towards the cervix. So this is the end towards the head of the animal. So incision was given from the ovarian end to the cervical end. Now the suturing should be started from cervical end to the ovarian end. Why this should be done? Since this portion will be free, but this portion will be attached to the cervix. So there will be pulling pressure from the cervical end. If we start suturing from this end, we are doing suturing from this end, but the uterus will be continuously tearing and incision will be extending towards the cervix because of the pressure from the cervical end. So always start suturing from the cervical end to the ovarian end. So like this only we should start the approach. And we should always go for double or two patterns. That means we should go first we can go for Cushing's pattern. After that, we can go for another Cushing layer, or we can go for the Lambert. Double layer suturing is very much important. So hereby showing the Cushing's pattern. So we are taking the bites parallel to the line of incision. This is the Cushing's pattern. So how to do it? As we all know, first we should give a knot here, and I am just showing how to do Cushing's pattern. That is taking the bites parallel to the line of incision. I am just taking the bites parallel to the line of the incision. This is the Cushing's pattern. Like this, we can go and end it. And this is how after finishing the suture, we can tell it whether it is a Lambert pattern or Cushing's pattern. In case of Cushing's, no suture will be visible outside the uterus. So this is the Cushing's pattern. So Lambert pattern. So here the bites we are taking perpendicular to the line of incision. This is the line of incision. I am taking the bite perpendicular to the line of incision. So now how to do this? So I am just explaining, I am just taking the bites perpendicular to the line of incision. This will take more suture material and more time, but we are doing one layer of pushings and one layer of Lambert will be good. So in case of Lambert suturing, more inversion will be there. So I am just doing the Lambert pattern of suturing. So like this, after suturing, we can see some parts of the suture outside in case of Lambert pattern, but both suture patterns are good for uterine healing. So after the doing that, we can suture the muscle by interrupted sutures or simple continuous pattern. So the size of the material should be number 1 or number 10. Number 10 is ideal. Even we can go for number 1. Polyglycolic acid, polyglactin 910, and catgut for the economical reason. In case of sheep and goat, for the economical reason, we can use catgut number 1 or 10. So coming to the skin suturing, any non-observable suture can be used. Simple interrupted pattern or horizontal mattress or vertical mattress. Any patterns of the can be used for suturing the skin. After this, antibiotic should be given for minimum 5 days. This is how we should approach. So I already explained the suture materials which are needed for the surgery. So this was a case presented to me with the both the limbs outside the body. So, but there was no space at all. And I went for cesarean, and that gave the animal gave birth to a live, healthy lamb. So this is a very rare thing which we observe under the field conditions, since the animals will be presented very delayed. But this case was presented in the early, and so because of that, this lamb survived. This kid survived. So this is after 1 year. This animal gave birth for the 3 to 4 times. After that, the animal owner sold the animal to others. So this is how we can double the income of the farmers by doing surgeries and also by approaching the case systematically. So this is another case of dystocia in case of sheep. So in case of sheep, one thing is we can take out the majority of the uterus outside the body, unlike in case of large animals. In some cases only we can take it out. So here we can see complete one horn of the uterus here. So after that incision was given, polyglycolic acid number 1 or 10 is used here. So here I went for a straight line incision. So this was a case presented very delayed condition. Was there was huge edematous swelling was there. I went for the straight incision, and this is how one uterine horn was externalized and proper draping was done and fetus was taken out. This is after suturing. We can easily tell it as this is a Lambert pattern as sutures are visible. So this is the skin suturing, and this was the fetus which was removed. This is another case of sheep which was presented with the dystocia. I went for this approach just below the flank fold, and this is after removal of the sutures. Skin suture should be removed after 10 to 15 days. So this is after maybe around 20 days. So like this, uterus was taken out. This is I am showing different cases here is this is the main important procedure which will give the more success even in case of large animals too. If we do this procedure, we will be very confident that the animal will survive. And this is after suturing, after the pushings pattern. So this is the fetus which was removed. And this is another case. This is incision was given above the flank fold. This was a goat. So sometimes what happens is the cases will be presented with a guarded condition. This animal was presented with very delayed condition in the lateral recurrency, and both the limbs were visible, and there was severe bleeding too. So when I examined the animals, so perrectally there was severe bleeding, and when I just passed my hand, I could even palpate some parts of intestines. So one thing is those intestines should be some part of the fetus. In case of cystosoma refluxes, we will get same thing. So if there is parts other than from the fetus, then it should be from the mother. So that is very guarded condition. Here I could palpate some parts here. So I decided to go for C-section. But here the fetus was taken out. After that only I could palpate some parts of the intestines. So after removing the fetus, since I was able to palpate some intestinal structures in the uterus, I went for opening the abdomen. That is, I did laparotomy for the particular case. Here we can see both the horns are normal. So I suspected uterine tear here. So I opened the abdomen immediately. So both the horns are normal. Always the tear will happen at the cervix, at the point of attachment of the uterus to the cervix. So this is the point of attachment of the uterus to the cervix. we can see that the uterus was torn here. Because of the excess handling by the owner, there was uterine tear prior to the attending the dystocia, which was presented to me. I removed the fetus. I just examined. I could feel that there was uterine tear. So I just opened it immediately to survive the. This was the point of tear. So I sutured it. It is very tough to suture, but since we should go up to attachment up to cervix, so I just sutured it, and we should thoroughly wash the abdomen with the sufficient quantity of normal saline. So we should do lavaging, and this is after suturing. This animal survived because of this different approach. That is lavaging. This is another case presented to me with the intestines hanging out through the vulva. This was also a very complicated case. I did cesarean in this particular case. There was uterine tear. This is the complete uterus which was taken out. So this was an emergency condition. I had no drapes, so I used this gauze as the drape, and there was uterine tear. This was sutured. So like this, this was sutured, and this is straight approach I went for. So main thing what I did is after lavaging, I inserted one Polish catheter into the abdomen. So I lavaged the abdomen with the metronidazole. So since I suspected the peritonitis set in, so you did lavaging. I lavaged the animal for 3 days with the metronidazole or normal saline with the help of Polish catheter. So this is after recovery. The animal recovered very nicely. So the same animal video is here. After around 20 days, the animal survived nicely because of the we gone for approaching with the cesarean, and we did lavaging, and after that one Foley catheter was inserted and it was managed. Similarly, I attended more than 80 cases similar peritonitis cases which were managed by the lavaging and also by inserting the Foley catheter in large animals. But in sheep and goat, I did this procedure in very few cases because of the very less number of cases like this were presented. So this is another case with the uterine torsion which was presented. I did manual rotation for this, but I failed to do correction of the uterine torsion. So I just went for the cesarean immediately. So after giving the anesthesia, epidural anesthesia, that is lumbosacral anesthesia, animal showing drowsiness of the both end. This is after surgery. The animal recovered very well. So another thing is last part of my presentation is blood transfusion. Many times, whenever the mishandled cases comes to us, we can treat them whenever there is severe bleeding after attending the dystocia or sometimes uterine tear. We can go for blood transfusion with economical price. So only with around 20 to 200 rupees, we can infuse the blood. So this is the euro bag, and sodium citrate is needed. So around 500 ml for an adult sheep or goat is enough. If we are having, this is the euro bag. This is available at around 50 rupees if we order it online in the bulk. So sodium citrate, powder and liquid are available. 3.8% readily available solution is there. So 1 part of sodium citrate, 9 parts of blood. This is the minimum thing which you should know. So this was this is not a dystocia case. Just I am showing that even blood transfusion can be attempted. So this was animal with severe anemia. So blood was collected from another goat. So with the help of microchip needle, we can collect it within 5 minutes. 500 ml blood can be collected like this. I'm just shaking it. This euro bag was taken, sodium citrate was taken in the euro bag, and blood is collected and it is transferred to the animal. So this animal survived. This is after giving the blood transfusion, animal survived. So the same thing can be used for the animals with severe anemia. We can go for the blood transfusion. Some of the take-home points are: first priority whenever a case is presented to us is the pain management before attending the dystocia. And second thing is we should do not exceed the dose limit of the lignocaine, since sheep and goats are very sensitive for the toxicity. Since in case of cattle, 10 mg per kg body weight is the toxic dose, but in sheep and goat, 5 mg per kg body weight even can create a problem. So third one is manual removal or surgery should be decided on the spot before attending. Just we should examine and we should decide it. Based on the condition of the animal, we should approach.